Hello everyone, it's Linda here from Just for Tummies and welcome to today's live event. And I'm absolutely delighted to, I'll be introducing my guest in a couple of minutes, Alison Leighton, who is a nutritional therapist, a colon hydrotherapist, and she is also the founder of Castorvida, and it's a company that supply high quality castor oil and castor oil packs. So I've been following Alison, well, Castorvida on Instagram for a few months now. I've been stalking her really. And I know a little bit about castor oil and castor oil packs, not a great deal, but I'm really looking forward to learning more because being a natural health therapist specializing in digestive health, women's health in particular, I want to learn more about how I can pass on this knowledge about castor oil and castor oil packs to my clients and customers. And we're going to be talking for about 45 minutes today. And it's going to be, I've got a series of questions to ask Alison about the history of castor oil. And with it being IBS Awareness Month, I wanted to know more about how castor oil packs can help reduce symptoms of irritable bowel syndrome. But I'm sure there are other uses of castor oil packing, and I'm just thinking about inflammatory bowel disease like Crohn's and colitis. I'm thinking about people who have those awful debilitating diverticulitis flare-ups, and then not to mention urinary tract infections and menstrual issues. So we've got to be really careful to stick to the program today. You know, it's about digestive health today and irritable bowel syndrome in particular. So if you're watching this live, welcome. It's great to have you here. If you've got any questions during the live, post them below this video. Don't worry if you can't watch all of the video today, because it will remain on the Just for Tummies Facebook page, it will remain in the Tummy Talk group, and it will be on the Just for Tummies YouTube channel and LinkedIn too. And we will be sending it out in a newsletter in about 7 to 10 days. So without further ado, I am going to invite Alison onto the screen. Hi there, Alison.
Hi.
It's great to see you again.
Thanks for having me.
Well, when we sent the email out, letting people know that we were going to do this live, Alison, I had so many replies back, not just from the general public, but from complementary health practitioners as well. Some colon hydrotherapists in there who, you know, really want to know more about castor oil and packs and how they can, like me, you know, share that knowledge with their customers and their clients. So I think it's going to be a really popular video, this one.
Yes, good.
So can you tell us a little bit about yourself, Alison? And
Sure.
because I know that you're a nutritional therapist, you're a colon hydrotherapist, and you're also the founder at Castorvida. So yes, just give us a little bit of intel about you.
So I am South African, and I moved here probably about 17 years ago. But I've always been interested in health and nutrition. And when our little boy was sort of getting ready for school, I was thinking, what am I going to do? How am I going to keep myself busy? And everybody sort of pushed me and said, go and finally do your nutrition. So I then studied at ION in London, Institute of Optimum Nutrition, and I was in my first year of nutrition, and I happened to be going to a seminar for some CPD points, and I ended up sitting next to a girl who is a colonic hydrotherapist.
Who was it? Who was it? I might know her.
Oh, I can't remember her name. I can see her face, but I can't remember her name.
Okay.
And we chatted. I think I chewed her ear off the whole time, and she just said to me, if you're really interested, read this book on colonics. I trained with the lady who wrote the book. I got the book, and it just made so much sense with the nutrition. It just tied in so nicely. So then I thought, I really wanted to go have a colonic and see if you like the treatment, and I felt, and I don't really, I'm lucky, I don't really have any digestive issues, but I felt so amazing afterwards that I thought, no, I'm definitely going to do this.
Yeah.
And before I even started my second year, I was qualified as a colonic hydrotherapist and started doing that. And actually, that's what I do day in and day out now. I mean, I talk nutrition all the time,
Yes.
and still love the nutrition, but it's the colonics that I
Yeah,
just
I was the
passionate
same
about.
in clinical
Mm.
practice. I came into it a little bit different to you, Alison. I was a massage therapist and acupuncturist, so did lots of deep tissue massage,
Mm.
myofascial release, cross fiber frictioning, therapeutic ultrasound, interferential. But I'd always kind of suffered with a bit of a lazy bowel, and I went to see a medical herbalist in Oxford who did iridology,
Oh
and she
yes.
I went to see her on about a different health issue, nothing to do with my lazy bowel. And she looked in my eyes and she said, well, before we sort out that other health issue, we need to sort out your bowel first, because that takes precedent. And she said, you need to have colon hydrotherapy. And I'd never heard of it. But to cut a long story short, she referred me to someone who was in practice not too far from where I live. And it made such a huge difference to how I felt and my bowels, of course, that I decided to train in colon hydrotherapy.
Yeah.
And then, so I kind of did half a week in clinic physio type work and the other half colonics. But it wasn't too long, Alison, before the colon hydrotherapy just took over. It just took over. So
My
busy.
waiting list is just, I mean, it's great, but it's when you're wanting to try and help people, it's not so great when you're waiting, you're fully booked like till May.
I know, it's crazy,
So,
isn't it? And it's one of the reasons that I was just the same. It was one of the reasons I decided to develop the Just for Tummies range, because I've got such a long waiting list for colon hydrotherapy. And yet you're probably the same people are saying to you, well, okay, you can't get me in yet, but can
is
you
there something else?
recommend anything to help? So I'd recommend diet,
Yeah.
lifestyle. I'd recommend certain supplements like probiotics, natural enzymes, charcoal, omega-3s, things like that. And then, well, it was my husband that said, it was his idea actually. Why don't you develop your own range? So
Range.
the rest is
Yeah.
history.
Yeah. And I suppose that's also sort of how I landed in with the castor oil, because
Yes,
in
tell us about that.
studying while I was studying nutrition, and I did a bit of a naturopathy course, and so we touched on castor oil packs, and I remember Roger teaching us about castor oil and castor oil packs in the colonic training, and I was then starting to do it and notice difference, but none of my clients were doing it because it was so messy and fiddly, and people
I
just said,
know.
I'm not going to do that. So then that's really how Castorvida was born, because I wanted to get it out there and make it increase the compliance and just make it
Yes,
easier.
yes.
So I sort of feel like my life, I had to do the nutrition to discover colonics, and I had to do colonics and nutrition to get to Castorvida.
I'm just thinking, Alison, I'm sorry, but when we spoke last week, I think I mentioned to you that when I went to the Viva May clinic many years ago, the first time I went there, they recommended castor oil packs, over the liver in the evening, and it was really messy, Alison. And
Really
when I went
messy.
recently last month, they still recommended the liver pack, but it was just a hot water bottle wrapped in a damp towel. I think you need to contact the medical
Them
reception
and get,
and tell them
yes,
about your
the product.
your packs.
Yes. Oh, I
Worth a
will.
try.
100%, yes. We
Contact
get
Dr.
lots of inquiries from Europe, actually.
Yeah, contact
Loads.
Dr. Stossier at the clinic there, at the Viva May clinic.
Oh,
It's
I
definitely
will.
worth a try. Anyway,
Yes, thank
sorry.
you. Yes.
Right, so regarding the castor oil packs then and colon hydrotherapy,
Yes.
did you put a castor oil pack on the abdomen whilst you were carrying out a colonic? How did
So
you do
I've
it?
done it once or twice. I don't do it regularly because, I mean, as much as I love castor oil, it is really thick and it is messy. So if it depends also on the client, if you know, I mean, I get clients that come in between work, so it's not going to work with their clothes. You know, you just don't want to mess up clothing and stuff like that. So, I will offer it as an option if they're really constipated, or if they've tried everything. I do offer it, but I don't do it very often.
Well, obviously, it must extend the treatment time of the colonic, and
Exactly.
so you
Yes.
can't always do that, can you? I
Yes.
understand that.
Yeah.
Yeah. Okay, so when did you, so you trained in nutritional therapy, then you trained in colon hydrotherapy. So when did you actually start using the castor oil packs?
So castor oil packs, I was using them sort of in the second and third year of my nutritional studies. I'd found out about it and then just sort of tried it. And I was doing it. It was also sort of, I was really using it a lot in lockdown because I had then time. But I was I mean, the traditional way of doing it is taking a piece of flannel, soaking it in the castor oil, wrapping yourself in cling film, which I never did because I just can't, I wouldn't understand why you would put plastic with the oil. So I never did that, but I wrapped myself in towels. But I literally couldn't move because if that towel fell down, I was going to have oil everywhere. So I just lay in bed, and so for an hour I just didn't move. But in lockdown we had the time, but I started delving into it while I was studying my nutritional therapy.
So what actually got you interested in using castor oil then? I mean, did you, was it like colon hydrotherapy where you went to a seminar and you were sat next to someone who was talking about colon hydrotherapy? How did it come about, the interest in castor oil?
I think the main catalyst was, I mean, we delved with it briefly in nutritional therapy, but it was one lecture we were talking about, and one of the students, she had endometriosis, and she spoke and she said that she does this every other day. She does a castor oil pack, and since doing the castor oil pack, she had no pain. Like, her symptoms were like so much better. So I thought, I'll just try it. I didn't really have any issues that I thought, oh, I need a castor oil pack for, but I've always been interested in alternative things. So I thought, well, it's just worth a try. I found then I found the castor oil packing, as they call it, and then I found castor oil, and I tried it, and I was doing it mainly over my liver. But then I was also doing it over my abdomen just because that's what I was reading up about. And I loved it. I loved that it gave me the time out to do things, like just time out for me. And it was so relaxing.
I can imagine.
So relaxing. Yes. Yeah. And so then I thought, and then I started talking to my clients about it. And I was telling them what was involved. And they were like, oh, but I'm not going to do that. And I even bought the packing. I bought oil to sell in clinic. And it just sat there. I ended up using it because none of my clients, it was just too much of a faff, and we are too busy to take time out for ourselves. So I thought this ancient, easy technique and remedy just needs to get out there. It just needs to help. It was, again, me wanting to help. And I just thought, if we can get this out there, people will do it and they'll see the benefits. But I just need to make it easier.
So, I mean, well done to you, Alison, for, for what you've done, but for making it so easy for people to use castor oil and pack in this way. That it's absolutely amazing. Congratulations.
Oh, thank you. And it's just like, I think it blows my mind still. Like, in my mind, it's just this little thing that I've created, but the feedback when people send in testimonials, like, it just blows my mind. Like, I think, wow, like,
it's no little thing. It's no little thing, is it? Really, it's a huge thing for those people who benefit greatly from what you've done. You've taken that castor oil and those messy pads and that, and you've just made it much more user friendly, haven't you?
Yeah, that is basically what it. Yes, that is the whole process now.
So tell us then, what exactly is castor oil? Where does it come from, and how is it manufactured?
So castor oil is the oil from the bean of the castor oil plant. our oil that we get, and we source it, comes from India, but it can come from various places, but the oil we use comes from India. And it has a 5-step manufacturing process. So they'll first harvest the ripe beans from the castor oil plant. Then they will clean it. It'll go through a process where they remove all
Can I
the...
just ask, Alison? Sorry, can I just
Sure.
ask? So the castor oil bean, is it inside a husk? Is it like a chestnut?
Yes, yes.
You know,
It looks like a chestnut. It's quite spiky, actually. It's like,
yeah,
yeah, it looks like a chestnut, yes. So when it's ripe, they will harvest that. Then they clean it by removing any debris and impurities, and then they press it. It's cold pressed
yes.
to keep, there's no heat involved, and that keeps all the goodness in the oil. So it's it's pressed so that the oil is extracted from the bean, and then gets filtered, just removing all the last bits of impurities, and then it gets bottled.
Ah, okay. I just want to bring this up on the screen. So this is from Sue. Hi, Sue, if you're watching. And Sue and I know each other quite well, although we've never met. But Sue is a Just for Tummy's customer. So she's been using your castor oil pack for over a year now, Alison, over her liver, since finding it via Katie Brindle. Yeah, Katie Brindle, the acupuncturist.
Katie Brindle is such a fan. She's just been amazing for us. She's wonderful.
I just thought I'd bring that up. Thanks very much, Sue,
Thank
for
you.
sharing that.
Thanks, Sue. Yes,
Okay,
no, Katie was amazing.
Just let me find them. Where were we? Right. There we are. Right. Okay. Then. So how long does it take from harvesting to getting the castor oil? You know, the purified castor oil. Is it days? Is it weeks? Is it months? Does it have to mature like a fine wine?
I'm not exactly sure on how long that takes, but I don't think it's too. I think once it's ripe, they need to get it filtered and pressed quite quickly. But it does have a 2-year shelf life, so.
And it comes in amber bottles, doesn't it?
Not all.
Oh,
You get
right.
different types of castor oil.
Oh, okay.
Ours does.
Yes.
And I would recommend anybody who does buy castor oil that it does come in a. Some people will sell castor oil in a plastic bottle or plastic container. So if you are going to buy castor oil, it has to be in an amber bottle to protect against this direct light, and it needs to be in a glass bottle.
A glass bottle. Yes.
Yes.
Right. Okay. Thank you.
Yes.
So, can you tell us a little bit about the history behind the therapeutic usage of castor oil then?
So castor oil has been around for centuries. It dates back to ancient Egypt. It can even be like castor beans can actually even be found or has been found in ancient tombs. So it's been around for ages, and historically it was used as a pain reliever, for digestive, and for any anti-inflammatory. So even back in that day, that's how they were using it, and it's interesting. That's actually how we are using it today. It was also used. It had it has moisturizing properties, so they were using it for moisturizing properties. It's some papers will say that Cleopatra actually used it to make the whites of her eye whiter. So it has a long history of using it. And then recently, castor oil packing became famous by Dr. Edgar Casey, and he brought in the castor oil packing, and he used it very successfully in his clinic with thousands of patients. He's written loads of books about it, but that's how I think castor oil packing really became famous. And it brought it back
very much like colon hydrotherapy. You know, it's been used for thousands of years, hasn't it? In various forms, of course. We use modern colon hydrotherapy now.
Exactly. Yes. But also like castor oil, and I don't think we've realized how common it is. But castor oil is used in over 700 cosmetic products. So it's around. It's all over the place. It's just not. We aren't aware that actually castor oil is one of the ingredients.
Okay.
So it is,
I wonder
it's used in,
if it's its Latin name that they put on the ingredients, like they often do.
yeah, maybe, yeah, because, yes, it would say Ricinus communis.
Oh, is that a Latin name?
Yeah.
Okay. Right. So, how does castor oil work then, both internally and externally?
The magic of castor oil. I sometimes find I have to like restrain myself because I can talk about it and sometimes it just sounds too good to be true because it can be used for so many things. But I mean, we recommend using it externally, but because castor oil is made up of this compound called ricinoleic acid, and it's only found in castor oil.
Mm-hmm.
This ricinoleic acid. So structurally, castor oil is much heavier than other oils. So when you apply it onto the skin, it gets absorbed much deeper into the bloodstream and then gets taken to organs where it does its magic. So it can help the liver it can help support detoxification. For us, especially about the topic that we're talking about, digestive health, it works on smooth muscle and it helps to contract smooth muscle contractions. And our colon is a smooth muscle, and that's how it can work for digestive disorders because it will help to stimulate smooth muscle contractions. So it will help stimulate the colon to move and pass food along.
And would the same apply if someone suffered with, say, IBS-D, where the predominant symptom was diarrhea?
Diarrhea.
Would it calm it down?
It does, yes. Yeah.
Okay. Okay.
Yes.
Right. That's great. I'm just going to say hello to a few people.
Okay.
Hi, Lisa. Hi, Jane. That's Jane Bush, another colon
Hello,
hydrotherapist.
hi, James.
Hi, Sharon. Hi, Sharon.
Hi.
Okay. So, right. Oh, hang on a sec.
But also another way that castor oil works, it mimics the anti-inflammatory molecules in the body. So it's really anti-inflammatory. So any pain, it's wonderful for pain. I've had somebody who I didn't know, she emailed in to say that she was using it on her knee and she was using the mini pack and you only use a tiny amount of oil. And she said, I was really skeptical about the tiny amount of oil that I was going to be putting on. And she said the pain went away nearly instantly. So it is amazing for any pain.
It's amazing. I mean, obviously, I'm contacted by lots of people, mainly women. And it's normally about, you know, the digestive, the gut health, or the bladder, vaginal health. But then as I'm chatting to them, you know, it often comes out because a lot of our customers are older ladies, you know, of a similar age to me, and some of them do have arthritis, you know, osteoarthritis, rheumatoid arthritis. So it's great to be able to have this knowledge that I can pass on to them and say, look, you know, give this a try a castor oil pack, go onto the Castorvida page and
that's why we created the mini, because for the smaller areas, wrist, ankles, knees,
and you got one there, so one of the mini ones. Oh, you've got one. Oh, I see. Yes, yeah. So right, so I can see the pad then. So you know the straps, are they Velcro or do they tie?
No, so I was really particular how I created my product. So I didn't want any plastic. I didn't want any nasties. It had to be as clean as possible, organic as possible. So the fleece side is organic cotton. The straps are organic cotton. So it's a ribbon. So there's no, like with Velcro, there would be plastic involved. So these are just straps that you would tie around.
Yes.
And
is that the smallest one that you do?
Yes, this is the smallest one.
So you can use that on the thyroid?
Amazing for thyroid.
Wow.
Can you see? Yeah.
Yes.
Thyroid, headaches, over your eyes if you want to put some, so that you don't put it in your eyes.
Alison, what about sinusitis? You know, I've just been getting a lot of people contacting me about sinusitis and sinus congestion. Yes, yeah.
Wonderful. I mean, they could just rub, because it will get absorbed. If they didn't have a mini pack, you could still use it and just rub it in, put it on. Yeah.
Could you, if you wanted to, just kind of dip your little finger in, or a Q-tip, for example, right, with a little bit of castor oil on, and just wipe it around the inside of the nose? I'm thinking
As a
more.
barrier.
Well, yeah, but I'm thinking more people that have got rhinitis as well. Yeah.
100%.
Yes. Yeah. Right. That's fantastic. Thank you.
Mm.
Right. Have you got anything else to add to that?
I mean, I could talk about castor oil and all its benefits much longer, but
I'm
I
sure we
think
could, and I'm sure we'll have to do another one specifically about. Well, you mentioned endometriosis, didn't you, earlier? But you know, women who suffer with painful periods, pelvic pain, pelvic inflammatory issues, you know, and UTIs, cystitis as well.
any
I mean,
inflammation, any pain, it's wonderful.
I'm kind of just going on. I'm sorry, I'm just doing a bit of blue sky thinking here. I'm just thinking about women, you know, postmenopausal women who, oh yeah, well, we've not mentioned about menopausal symptoms. Postmenopausal women, when they get a lot of issues down below, you know, when the tissues start to thin in the vagina, and it can get
Yeah.
very sore, and splits can occur, you
Yeah.
know, very painful. Could you put a castor oil pack on there? Could you just smear some castor oil on that area?
I'm sure you can. I haven't tried,
Yeah.
but even if you use like as a pad or something, put the oil on. I don't see it doing like I can't see why you wouldn't be able to use it. There's no contraindications with
No,
the castor
no.
oil, so anything I think to help, it's worth a try.
You know, I'm just thinking about other things as well. People who, you know, like boils and carbuncles and, you know, things like that. And other skin issues like eczema, psoriasis.
It's wonderful for that. Yes,
Yes.
wonderful.
Anyway, Alison, we have got to be careful not not to digress. So I'm going to bring it back to
Okay.
IBS awareness month. So
Yes.
yes, can you explain how this treatment can help with IBS symptoms? And I assume that the pack that you put on the abdomen, it's a larger pack. Is that one? Is that the largest one that you do?
That's the largest one we do, yes.
So do you do two packs then, the smaller and the larger one?
So this is the regular pack,
Yes.
and then we have a large pack. The only difference between the regular and the large, the actual pack size is the same, the strap length's just longer.
Ah, okay. Oh, I
Okay.
see. I
Yes.
see.
So
So that's for people of different sizes, is it? Yes.
exactly.
Yeah.
Yes.
Okay, that
Yes.
makes sense. Right.
Yeah. So you would then use this if you have IBS, you would put it. I'll stand on my tippy toes so you can see, but you could. I'll
You
bring
can
the camera
see. Yeah.
down.
Yeah.
You would tie it around,
Okay.
and the
How
length.
long would you leave it on there, Alison?
How long?
Yes.
At least a minimum of an hour. But there's enough space in between the straps that you can put a hot water bottle in there for added comfort
Oh,
as
I
well.
see. That's a good idea.
Yeah.
Yeah.
And then you just tie it into place. And then you can walk around, you can carry on doing your.
Well, yes, of course, of course. Where
I
before, when you're faffing about with the towels and the cling film, you can't, can you?
No, you can't. No, I've actually had it on, forgot I had it on, and realized when I looked down at Sainsbury's that I saw the straps dangling down, and
Right. So,
how
how
does
much
it work?
castor oil would you put on the small one, and how much on the regular one then?
So on the regular one, you start with 2 to 3 tablespoons,
Mm-hmm.
and then the more you use the pack, less you use less oil.
Yes, I remember you said this to me the other day.
Yes.
So, okay. So, how often would you wash the pack then? And do you, and when you've used it and it's got castor oil on, do
Yes.
you have to put it in a bag to keep it clean and moist? What do you do with it?
So when you buy a castor oil pack, it comes in a tube,
Mm-hmm.
and you can store your pack in the tube.
Yes.
Or sometimes my tube is downstairs. What I then do is I fold it so that the oil sides touch each other and there's no oil, and then I fold it neatly like that so that the oil is contained, it doesn't come out.
What, and then you put it back in the tube?
You can, or if I don't have my tube with me, say for whatever reason, I will just put it in my drawer like that.
Oh, okay. Yes, yeah.
Yeah.
Okay.
But
Right.
just if you're scrunching it up and there's going to be oil everywhere, then it's not ideal. But if you fold it nicely so that there's no oil running around, yes, then, but it's easier in the container.
Okay, so sorry, going back to how much castor oil you use then. So how many times would you use it, putting castor oil on, before it needs washing?
So we recommend wearing it 3 to 5 times a week. But we have lots of people who sleep with it or wear it every day. But I would say you really, you know when you need to wash it, but in our instructions we say after 10 to 15 uses.
Does it start to smell after a while?
It doesn't smell. No, it doesn't smell. It just becomes quite saturated with oil.
Okay. Is castor oil a natural what's the word I'm looking for? Not an antibiotic, antimicrobial.
Yeah.
Yes.
That's why it's great for any skin conditions.
That's what I'm thinking. So nothing will grow on it, you know, bacteria, fungi can't grow on castor oil.
No.
Yeah. Okay. Right. That's great. So,
So
sorry, did you cover about how much castor oil goes on the small one and the regular
small one? So the big one is 2 to 3 tablespoons, and then the mini. I mean, there isn't a big surface space, so you would use a teaspoon.
Okay.
And then you put it on the fleece side.
Yes.
Fold it in half, spread it around, and then you apply it.
Okay. Can these be used on children?
Yes.
What about babies? Like babies that have got colic, for example.
It's wonderful for that.
Oh.
Our packs are just a bit big, so some people will use the mini on a baby.
Yes.
So it is one thing that we've been asked to look at, is to make a smaller pack for kids. But my advice for kids is just start slower and be gentler. Their bodies are so good at
absorbing.
Yes. So start slow, like even 10 minutes to 20 minutes, not a whole hour.
Yes.
And I mean, the body is amazing at if you give it what it needs, it knows what it needs to do.
Absolutely. I'm a big believer in that. Absolutely.
Yes.
Okay.
So with kids, just start slow and see how your child responds to it. And then you can always increase the length of time, but just start slow.
And of course, anybody who has any queries or questions, I'm sure they can contact you or your team, and you can advise them accordingly, Alison.
100%. We have questions daily from people, and I'd rather people come to us and ask the questions, and then do it right, then they're using it, and then they think, oh, it didn't work, or it's rubbish, or whatever. Ask us the questions. We're always happy to help and answer.
I'm the same with Just for Tummies. I'd rather people come to us first, you know, so we can take some like case history, and then we can advise them accordingly on what they need.
Exactly. Right. And some people will say, oh, it's a silly questions. They're not silly questions. They're relevant. So yeah.
No question is silly, is it?
Yeah. No,
right.
exactly.
So just going back to, because it's IBS Awareness Month then. So what would you recommend? So well, people would come to you for colonics, right? They'd have colon hydrotherapy, and then would you recommend them to do some castor oil packing, you know, as part of their maintenance program? Yes.
And it's also nice if not everybody can do colonics all the time or keep up with the colonics. So this is a great way as an in-between treatment, just to support them along their journey.
Well, I'm just thinking about people who have got contraindications to colon hydrotherapy.
Exactly.
You know, where they can't have the treatment.
This is a great. You mentioned those inflammatory diseases earlier, where we can't do anything with them. That's wonderful for them.
That's right. Right.
Yeah.
Right. That's great. Thank you. So we've done that. Oh, yes. Yes. Well, I know that castor oil can be consumed, Alison, because when I was a child and I suffered with I was given castor oil and syrup with figs. So how much is I mean, I know you specialise more in the packs, but
Yes.
how much is safe to take, and how and when would you take it?
So not all oil, like I said, is made the same. So if you are going to take it internally, just make sure your castor oil is food grade. Ours is food grade, so it is safe to take internally. Because I haven't designed my product for that, I can't advise on how much to take or what is the recommended dose. So I don't know. I do know people take it. I spoke to somebody earlier and she said they mix it with orange juice just to make it a bit more palatable and drink it. But it's really aggressive and it is fast working. So I don't think you need a lot.
Oh, you mean it's fast working on the bowels?
Very fast moving on the bowels, yeah. And it can be quite urgent and quick and aggressive.
Okay, okay, thank you.
So how we use it is just more gentler.
Okay.
Yes.
So you've talked about grades and quality of castor oil. So I mean, are they graded like 1, 2, 3, 4, 5? How do they grade them?
I think it's more to do with if it's organic or not organic, if it's cold pressed, not cold pressed. Castor oil is also used in the motor industry, so make sure that if you are getting castor oil, it's hexane free. Hexane is a compound used in the motor industry, so just make sure that you get the cleanest, the purest castor oil.
Do you know, there used to be a commercial on the television, I remember now, and I cannot remember the make of castor oil. But it was to put in your car engine. Yeah, I'd forgotten about
I mean,
that.
it's used for so many things.
Yeah, yeah, yeah.
So as long as it's in a glass bottle, it's organic, cold pressed, you're pretty good. Hexane free.
Okay, so we've touched on this. Can castor oil be applied directly to affected areas without using the packs? Well, yes. I mean, you mentioned the skin, didn't you? So it can be applied topically. People
100%.
that have got eczema, psoriasis.
Skin, hair. I mean, so many clients get psoriasis in their scalp. So it's wonderful for hair growth.
What about dandruff?
Eyebrows, eyelashes. That's what castor oil really is having its moment at the moment. But for anything for the skin, I mean, you can. You don't have to use a pack. The reason I created the pack was just because castor oil is very messy and it can stain. So people can use it wherever they want to. Just be mindful that it might stain their clothes. So even when we sell the pack, we still tell people don't sleep in your best pajamas. Put a towel down on your bed because if it moves and you get oil on it, it can stain.
Yes.
It's a thick oil.
Is it difficult to wash out then?
I think if you have it on, get it on your clothes once or twice, it will come out, but prolonged use will stain. Yes.
Oh, there's someone else. It was a fan, Karen. I love that. What do you use it for, Karen? Be interesting to know. And then a question here from Noreen. Hi, Noreen. How often would you need to have the castor oil treatment? Now, does that depend upon what she wants to use the castor oil for, Alison?
100%, yes.
Yeah. So, Noreen, you need to let us know what you'd want to use the castor oil. Oh, somebody's just reminded me, Alison, about that motor oil. Oil GTX. That's the one, isn't it? That's the one. And another Facebook user, I think will be someone from Tummy Talk. I'm so excited to learn about this. Yes, and so am I. It's great information, isn't it?
It's great to share all of this.
Yes, it is. It is. So, where were we? Oh, I think with yes, on Tummy Talk a couple of weeks ago, I think it was when I put some information on about castor oil. Somebody mentioned about castor oil being poured into the belly button. Is this true, and why would someone do this?
It's massive on social media now. Loads of people are doing that. It is good. You've got so many nerve endings in your belly button. So wonderful, great. Definitely recommend it. You can rub it into your belly button.
Well, again, for gut problems or for menstrual problems or for that whole abdominal
that whole area. Yeah.
That whole area. Right. Okay. Great.
Yes.
So we've covered this, haven't we? Why did you set up Castorvida? Yeah, we've covered that.
Yeah.
You want to say anything else about that, Alison? Why you set it up? No, that's fine.
Just to
Right.
help people.
Are there any side effects from using castor oil? Oh yes, I knew I wanted to ask this one. Yes, and is it safe for everyone, including babies and children? You've already said yes, definitively it's safe for babies and children, but are there any side effects?
We just don't recommend it for people who are pregnant. Again, your uterus is a smooth muscle, so we don't want to bring on labor when it's not ready to bring on labor. So don't use castor oil or castor oil packs when you're pregnant or when you are breastfeeding. There are exceptions, and for breastfeeding, and people can email me about that and specific questions. It also depends on how often you're breastfeeding, how young the baby is, where you are needing it.
I'm just thinking about, women who are breastfeeding, if they've got really sore, cracked nipples.
So that's the thing where so there's such contradictory advice. So it's actually castor oil on your breast if you've got mastitis or to bring on milk is wonderful. But then you've got to really be mindful that you need to clean your breast before breastfeeding, because if the baby ingests that, your poor baby's gonna have such bad diarrhea. So if you are struggling and you've got mastitis, it's wonderful to use castor oil to encourage milk flow, and for mastitis, just make sure you are really, really cleaning your breast before you are feeding.
Yeah, that's interesting. I mean, talking about breast tissue, some women suffer with lumpy breast, don't they? Kissing the breast. So, putting castor oil packs on breast tissue.
Amazing.
Doing a little bit of kind of lymphatic drainage in that area.
Wonderful.
As well.
Yes.
Yeah. Right, great. So, oh yes. So, can you give us a couple of examples of how castor oil packs have helped people who suffer with digestive and gut issues?
So funny you say that. Our testimonial this week, and I'm just going to open my social media, is from somebody who wrote in and said, I was trying to find all my gut health testimonials, but this woman has said, the only thing that has fixed my digestion system is this castor oil pack. It's incredible. The product has changed my life. I've tried countless expensive supplements and powders, acupuncture, diet changes, everything. And this castor oil pack is the only thing that has helped my digestion. I noticed an effect the following morning. I don't know how it works, but it's been amazing for my gut health.
I don't know how it works, and I don't care. It works. Yeah, that's wonderful. Thank you. Do you have any videos on your socials that demonstrate how castor oil and the packs are used? I mean, I'm assuming if someone buys one of your packs and the castor oil, you do send instructions. But have you got any videos?
With every pack comes instructions, and there's also a QR code that if you click on it or link it, I don't know the terminology, but if you click on it, it'll take you straight to our YouTube video. There's a YouTube channel with all our videos. It's also the video on how to use a pack is also on our website. And I'm quite active on Instagram with my reels. So there's lots of reels on how you can use it and all sorts of videos. But yes, there's lots on our YouTube channel, on our video, on our website, and social media, on Instagram.
But you and your
TikTok as well. I'm learning TikTok now.
I did have a go at TikTok, and then I thought, oh no,
I just don't understand TikTok. Anyway.
I can't do that as well. Right, so yes, how can people contact you, Castorvida? What are your handles? And well, I'm assuming everything's Castorvida.
Yes, so the website is castorvida.co.uk. If you have any international people, we've launched Castorvida South Africa, so that's quite exciting. And then, but social media, Instagram, we are Castorvida with a underscore after Castorvida. We are on LinkedIn, we are on Twitter, we are on YouTube, TikTok.
You're everywhere.
Everywhere.
Right, someone has Karen. Karen's come back to us. Karen Binidel. I use mine for digestive support, hormone balancing, and liver detox. I also use the oil on my hair and eyebrows. Right,
That's good to
amazing.
know.
Thank you. And Poppy, I don't know if you know Poppy Hunjan, Alison. She's
No.
another Crohn hydrotherapist. So yeah, she grew up in India. My grandmother used to give us 1 tablespoon once a week for clear out. Also Indian head massage once a week with castor oil blended with other base oils and essential oil.
I love it on my oil, and
Thank you so
it's
much.
wonderful.
So does it help thicken hair then?
Yes, it's amazing.
Mm,
Really helps with hair growth.
mm,
Mm.
mm. Right. Well, I think that's it. I mean, I'm sure we could talk at great length
It's like a
about the
whistle stop
many
tour.
uses of castor oil, Alison, and certainly when it comes to women's health issues. But we'll have to do that another day.
Yes, I think
So,
so.
so I just want to thank you so much for your time. It's been absolutely fascinating.
Thank you.
I mean, I've been a practitioner for over 32 years, and I call myself a perpetual student. You know, I love learning new stuff, new knowledge that I can pass on to other people.
Yes.
Every
Day is a school day.
Every day is a school day, yes. So, like I say, this video will remain on the Just for Tummies Facebook page, the Tummy Talk community page, on LinkedIn, and it will be posted on YouTube as well. And then we will be sending it out in a mailer within the next 10 days. But you've given us a special code as well, haven't you, Alice?
Yes.
So people can get 10% off any of the Castorvida products.
That's correct. Yes.
Is Tummies
10.
So that's,
and it's all capital letters.
It's all capitals, yeah. TUMMIES 10, all capitals, gives people 10% off.
That's right, yes.
Order. So thank you very much for that.
That's all right, and I think that's active until the end of
the end of this month. I think it's the 30th of April. Yes, that's right.
Yes.
So anyway, everyone, I hope you enjoyed that. I certainly have. And big thank you to Alison for developing Castorvida and these packs, and it just making it the whole thing so much easier and less messy. And many congratulations, Alison.
Thank you so much. Thank you.
I'm just going to finish the video, Alison. If you can just stay around for a minute or two.
Perfect. That's great.
Thanks, everyone. Bye for now. Look forward to seeing you on the next video, which is I'm going to be talking to Sophia Hill, nutritional therapist. We're going to be talking about how very often IBS can be misdiagnosed when in actual fact it's SIBO, small intestinal bacterial overgrowth. So we're going to be looking at the the differences between the two and why often it's misdiagnosed. So thank you, everyone, and just stay around for a minute, Alison.
All right.